future around good food for the residents in Jersey City, and how we believe some of our work can be shared as models for other spaces of thought leadership and moving forward in this arena. So one of the key things that we're actually rolling out as a health department over the next week, Wednesday, if you're all not doing anything.
Which is different from all the media that's gone out, having this go on to Monday. It's not a change of date.
Yeah, we're a little nervous about the snow, given some of our history, but we're moving Jersey City forward. And so many people that have already caught up with the State of the City address and kind of looking at economic development and how we're looking at rebuilding creative spaces and community. The health department sees food and food resources as a really integral part of that. As part of our campaign for 2014, we're rolling out what we're calling the Partnership for a Healthier Jersey City. We've been hashtagging Healthier JC for some time, trying to build some momentum, and really on Wednesday, we're proud to introduce sort of how we're going to continue to convene activities at the health department without tripping over sort of the other activities that are going on in town, and really aligning with the administration's goal to streamline, deduplicate, and really sort of find some ways that we can make results happen, and for you to know a little bit more about those results. So over the last 8 months, what we've really done is we've tackled some key issues, particularly around food. I came on in the middle of the summer where we were in the midst of some summer meals programming where we were serving somewhere close to 15,000 meals a week across Jersey City in 75 locations, which is really exciting opportunity for people, particularly in low-income neighborhoods, who really focus on going to school to get some of those supplementary meals. And this is really a great opportunity for the city to really take a role in this. And we're one of the only cities that runs that kind of program. So in addition to that, we've been really interested in driving what the child and adult care food program. So a lot of these kind of multi-million-dollar federal food programs haven't really come to Jersey City in a long time, and they might be operating in small locations across the city. And we do know, obviously, daycare centers, Head Start, school systems do run federal food programs. Our goal is to really provide more food for at-risk youth that are in the school doing after-school programming, and really providing them a snack and a dinner. So it alleviates some of the other things going on in major households that might possibly keep a kid from eating at night. So we really are looking at that from a framework of human service support, good and healthy food. And I think some people over the course of the last few years of looking at where our federal policies have gone around the Farm Bill and around child nutrition reauthorization might really think about how healthy are these food options. And I will tell you that we've got a really great team on board to make that happen. And I'm lucky enough that Julia and Sergeant Allen joining the health department. She's the founder of the JC Food Co-op, and it's been really helping us look at the child and adult care food program in a different way. So we're hoping to roll that out in April. We've been approved for nearly $400,000. We've got 6 partners thus far. We're going to be providing dinners and snacks for kids in enrichment programs across the city. And so that's sort of the next tier. That doesn't mean we're leaving anyone out. So there's some friends in the audience that we've been partnering with, like the Sharing Place, where we're hoping to expand some of our senior meals. And so places where seniors come together in congregation, and our congregate meals program is currently operating in 9 locations across the city. We're interested in expanding that to 11 locations by the beginning of the summer. And so we're hoping to be able to continue moving people forward and doing that. We need partners, and so that's really some of the key components of the Partnership for a Healthier Jersey City. The partnership is really, in essence, a replicated program from across the country, particularly from the CDC grant program for transformation neighborhoods. We feel like Jersey City is very ripe for transformation right now. And so from that space, we're taking some models that we've seen, particularly the New York City model, and changing it to meet the Jersey City needs. So we're really looking at a ward-based philosophy for creating healthy action coalitions. So after Wednesday, where we talk about some of our key goals, which are expanding community education, increasing active living, providing greater healthy food access, providing greater awareness around child immunization, and then improved pet wellness. And I think many of you would appreciate that, kind of teaching some pet owners how to be better pet owners. We're really excited about having the community tell us sort of what their goals would be in those areas, like how do they want to see that measured. And so these are really global ideas and concepts, and 3 of the 5 of them really kind of marry into good food now, right? Some active living. So Health and Human Services has just taken on the Adopt a Lot program. So we have become the housekeeper of Adopt a Lots, and we're rolling out sort of our pre-season meeting next week. We have a staff member that's going to be working with the community organizations for both the private and the public community gardens. Many of those gardens grow food. Many of those gardens are areas of community education. Many of those gardens are keeping people active. And so those are really some things that we're excited about. We're also on Earth Day. We're kind of scheduling Earth Day a little bit later. We're going to have a big event at City Hall, where we're going to inform people of some lots that still need to be adopted, and sort of the support that the city can provide to move that forward. And we've been partnering with City Green, and so we'll be getting people their topsoil and getting a list of sort of the needs that people have to really engage in a way that's important for their community. And so, we think that is a key place where we can integrate sort of a lot of the hard work that we do as leaders and really bridge the gap with some of the needs in our community and make it look prettier, have people happier. I see that like happy JC movement rolling around, and all of those things make people healthier. And so that's a big part of our interest. In addition to that, we're not only going to say like let's host these ward meetings, but we actually have a team of community educators that are going to be managing by ward, how they can keep and inform you of success. Of what we're doing by ward. We're going to be informing the council. This is going to be added to the mayor's data dashboard project. For those who don't already know, we track everything we do, and we've been doing a really good job of making that happen. Some spaces where you'll see some excitement is in our WIC program. We run about a WIC program for 12,000 people. That program is currently in the hub. We're going to be opening up a new location on Summit Avenue as a part of the Community Health Campus. And in that location, we're going to be able to have a lot more health and community education. In addition to that, we received a grant from Share Our Strength to work with our WIC population and teach them how to shop better. Utilizing their subsidies so that they can get, the best bang for their buck and continue to maintain a healthier lifestyle. So that's sort of the one, kind of point of engagement where we're looking at in knowing that people already have subsidies, and how do you make those subsidies work. And in Jersey City, that equals to about $23 million in food money. And so that's really important for us to know, because without a WIC program and without that driven education around nutrition and healthy babies, that's a space where we can really make a difference. And right now we're really excited because we're waiting to hear the announcement of the new WIC director that can take us forward across the state. And we're hoping that engages some really key things on a policy level that looks at how we work with farmers markets better, and how we can use the WIC monthly cash value voucher at farmers markets. And those are some state legislation issues that we're looking at from a policy perspective. So this is where the health department sort of integrates sort of the day-to-day, the community ward-based education that we're really excited about. And next week we're sort of rolling out, and you'll see over the next 9 to 12 weeks, our goal is to have at least one, this is baseline, right? And then whatever sort of the community is interested in and how we can partner is one education workshop per ward per week. And so we're sort of getting out of the best place to have an event is City Hall, because it's really not. And really no one can get there outside of a certain amount of hours, and how we can make that happen. And so the administration's been committed to making sure things happen across this great city. So we've been really excited in engaging in this way, and we're really hoping that all of you join the partnership, because it really will make a big difference. And when we roll this out next Wednesday, 8:30, coffee in the Rotunda, healthy breakfast. That was really difficult to find. Yes, no one wanted to not give us donuts, and I was like, there are no donuts. So we will talk a little bit about sort of what the city's been doing and how we can model things in the community, and how you can take on the things that you're already interested in and partner with us and utilize and leverage some of that branding across the city, and some of the additional branding that we're going to be looking forward to, having once we are done with some of the work that's happening at the administrative level, and really sort of creating a citywide calendar of healthy Jersey City events. So we've got our March calendar sort of ready. It's not yet on the website, if you all know how we operate. It's got a little ways to go there, but that is part of the goal, and in partnership we believe we can get there. And we think that there's many avenues where we can really focus on good food for all residents across the life cycle, and adding to that in a really strategic way is why we are really happy to be here and partnering in this way with kind of that framework of sustainability, and kind of making things greener and making things healthier and really moving forward. So thank you.